Well, for more on China's vaccines, we're joined by Dr. Kate Tulenko. She's founder and CEO of Corvus Health, a global health firm. Always good to speak with you again, Dr. Kate Tulenko.
Thank you.
So China currently has two vaccine frontrunners produced by Sinovac and Sinopharm. Tell us more about them, how they work, and how do they differ from those being administered in the West?
Certainly, the ones being administered in the West, the Pfizer and Moderna, are the mRNA, the messenger RNA vaccine, which is a new type of vaccine, and it's being rolled out for the first time. The two Chinese vaccines, however, are traditional vaccines in that they are killed virus vaccine. They are coronavirus that's been killed, and it just gets injected into the body, and the body reacts to it. It doesn't need as much of a cold chain. It can be stored at regular refrigerator temperature, so it should be much easier to roll out. But I also wanted to put this in the context of BRICS. BRICS are Brazil, Russia, India, China, and South Africa. These are the emerging manufacturing powerhouse countries. And in the past, with new emerging diseases, these countries had not produced new vaccines. So this is the first time that you see three of them, Russia, India, and China, all producing vaccines for emerging disease.
And are they also then targeted for that market, would you say?
Yes, so because the other vaccines, Pfizer, Moderna, J&J, AstraZeneca, are produced in the West, produced in Europe and the US, the labor costs, the development costs are all high-income country costs, so they're more expensive. However, these vaccines that are developed in the BRICS, in India, Russia, and China, they'll be much more affordable because you have much lower labor costs, lower land, and other supply costs.
Right. Now, the Chinese government has been using the Sinovac vaccine since last July for high-risk groups. What do we know about how effective they are?
Yeah, so they've been using them in the military and in contractors traveling overseas and students traveling overseas. So it looks like the Sinovac and Sinopharm are about 78, 79% effective in presenting symptomatic disease. And that compares to Moderna and Pfizer in the area of about 94 to 95%. So they're not as effective, but still, given the nature of the pandemic and that they're safe and effective, definitely worth rolling out.
Right. Now, we've been talking about the handful of countries that are producing them. A lot of them are also signing up to the Chinese-produced vaccines, among them Brazil, Indonesia, Saudi Arabia, even Singapore. Why would you say they're not more?
Well, I think that there's a little bit of caution, because the full data hasn't been released yet. So compare that to the process with Pfizer and Moderna with the U.S. FDA, where the data was published, and in fact the proceedings were televised live, so anybody could watch them. We're still waiting for the data to be published on Sinopharm and Sinovac, and I think once that's done, you might see more countries signing up.
Why is there this general lack of trust, would you say? Because, I mean, Sinovac has an established reputation even before the pandemic. It was the first to develop an experimental drug for SARS.
But remember, 2 years ago, China did have the scandal with the ineffective vaccines that were given to babies, and there was also a bribery scandal. So I think that there needs to be a bit of trust building coming out of this. And plus, we have to remember there's been so much misinformation about COVID and about the COVID vaccines that we really have to combat that with proper information.